Hello, my name is Daisy, and today I'm going to be performing the skills for a central venous line dressing change. So the first thing that you want to do is you want to go ahead and make sure that you have a doctor's order in place to be able to change the dressing, the dressing on the central venous line. After you go ahead and make sure that the order is in there and that you're in the patient's correct room, you want to go ahead and gather your supplies, which include clean gloves, a mask, and your central line dressing tray. So when you come into the patient's room, you want to knock. You want to go ahead and perform some hand hygiene, introduce yourself, provide the patient some privacy, and identify the patient using two identifiers. You can use the first and last name and the date of birth. After you do that, you want to go ahead and explain to the patient that we're doing a dressing change today. A dressing change on her central line today. And so that we can reduce her anxiety and so that she has an idea of what we're going to be doing today. So I'm going to go ahead and perform, and I'm going to also put the bed in a working position. So after all of that is said, and we've already provided the patient with privacy, I'm going to go ahead and perform some hand hygiene and apply my my mask. And then we're also going to, and these are my clean gloves, so we're also going to go ahead and have the patient turn away from the central line, just so that there's no contamination going into it. So Miss Jane, I'm going to go ahead and have you turn towards the wall, okay, while I'm doing this dressing change, and I'll let you know when you're able to turn back. Okay, so the patient has turned her head towards the wall, and it's going to remain like that until we are done with the dressing change. So we're going to go ahead and remove the patient's dressing. We're going to go ahead and be careful when we are removing the old dressing. Okay. So whenever we remove the old dressing, I'm going to go ahead and throw it in the trash. And we're going to go ahead and assess the patient's central venous line site for any signs and symptoms of infection like drainage, redness, warmth, or any other signs and symptoms that may be present. So since we've already went ahead and assessed the insertion site and sutures, if there were in there, we're going to go ahead and remove our clean gloves, throw them away, and then perform some hand hygiene. And I'm going to go ahead and open my sterile central line dressing tray. I'm going to go ahead and open this away from me. I'm going to go ahead and grab my gloves. And I'm going to go ahead and open my away from me. Okay, so this is going to be my working sterile area. So now I'm going to go ahead and apply my gloves after performing hand hygiene one more time. And due to the circumstances, I'm here in a tight space, but usually in a hospital setting or somewhere else, I wouldn't have this problem. Okay, so I'm going to go ahead and apply my sterile gloves on. Okay, so I'm still sterile. I'm going to go ahead and grab this since it's sterile in here and throw that away. Okay, I'm going to go ahead and grab my my ChloraPrep and then cleanse the skin. Okay, so in this circumstance, we would go ahead and pop this, but for this scenario, I'm not going to pop it, but we'd pop this and we'd go ahead and cleanse the patient's site. So we'd go from inner and then we scrub outer. Okay, So after we're done with the ChloraPrep, we can go ahead and get rid of it. Okay, and I'm still sterile. So what we're gonna go ahead and do is, since this area is still sterile, I'm gonna go ahead and grab the I'm gonna go ahead and grab this, and I'm gonna go ahead and, so I'm gonna wait for the ChloraPrep to air dry. I'm not gonna go ahead and blow it or anything. I'm just gonna go ahead and wait for it to air dry. Both hands are still sterile, so I'm gonna go ahead and apply this to the patient's site. Okay, and then I'm also going to go ahead and grab the clear transparent dressing, and I'm going to go ahead and apply it to the patient. Okay, so for the purpose of this video, I'm not actually going to open it, but I would open it and then apply it to the patient's site. And then go ahead and like make sure that there's no openings or no air bubbles in under the dressing. Okay, so after we do that, we want to go ahead and make sure that we again, make sure that there's no opening areas or no air bubbles under the dressing. And we're gonna make sure that after we're done, that the dressing includes the patient's, that the dressing includes the nurse's initials at the time and the date that the dressing was changed, so that the next nurse knows whenever it's time for a new dressing change. Now that has been done, the patient tolerated well. There were no signs and symptoms of infection or complications when it came to doing the dressing change, and we remained sterile during the whole procedure. So I'm gonna go ahead and make the patient comfortable again, the bed and lowest position, call it within reach. I'm gonna go ahead and remove my gloves. Perform some hand hygiene, and I would go ahead and put on some clean gloves and remove all of the supplies and throw them in the appropriate receptor. For documentation purposes, you want to go ahead and make sure that you document that you did a central venous line dressing change, that there were no complications at time of the dressing change, and that the patient did not have any signs and symptoms of infection to the site. So after I cleaned the patient's skin with the ChloraPrep and allowed it to air dry, what I applied to the patient's site was a bio patch. So the bio patch would be, and because I don't have the actual bio patch with me, the blue side would be facing up, and the reason for the bio patch would be to reduce the number of microbes that could potentially get into the patient's insertion site.